Vaginal changes through life.
The vagina undergoes various changes throughout a woman's life, influenced mainly by fluctuating hormone levels, particularly estrogen. Here's a breakdown of these changes across different life stages. Infancy.
Influence.
Affected by maternal estrogen that crossed the placenta during pregnancy.
Characteristics.
The vaginal lining, mucosa, might be relatively thick and the pH acidic, similar to an adult's. There might even be some whitish discharge or slight bleeding as maternal hormones withdraw in the first week or two.
Changes.
After the maternal hormones clear, the vagina transitions to its childhood state. Childhood, pre-puberty.
Influence.
Very low estrogen levels.
Characteristics.
The vaginal lining is thin, smooth, and pale pink or reddish. The pH is neutral to slightly alkaline, around 6 to 8. There is typically very little or no noticeable discharge. The vaginal environment is less protected against infection due to the thin lining and higher pH. Irritation, vulvovaginitis, from soaps, poor hygiene, or tight clothing can be more common. Puberty.
Influence.
Rising estrogen levels stimulated by the ovaries.
Characteristics.
Estrogen causes the vaginal lining to thicken, become more elastic, and develop folds, rugae. Glycogen, a type of sugar, content increases in the vaginal cells. Lactobacillus bacteria, healthy bacteria, begin to colonize the vagina. They feed on glycogen and produce lactic acid. The vaginal pH becomes acidic, around 3.8 to 4.5, which helps protect against harmful bacteria. Clear or whitish vaginal discharge, leukorrhea, begins and is normal. The external genitals. Vulva also mature and pubic hair grows. Reproductive years.
Influence.
Cyclical fluctuations of estrogen and progesterone associated with the menstrual cycle. High estrogen levels overall compared to childhood or postmenopause.
Characteristics.
The vaginal lining remains thick, moist, and elastic. Acidic pH is maintained by lactobacillus. Normal vaginal discharge varies in amount and consistency throughout the menstrual cycle, thinner around ovulation, thicker at other times.
Pregnancy.
Significantly elevated estrogen and progesterone cause further thickening of the vaginal wall. Increased blood flow can sometimes give a bluish tint and a marked increase in vaginal discharge. The risk of yeast infections can increase.
Postpartum.
Immediately after birth, estrogen levels plummet dramatically. This can lead to temporary vaginal dryness, thinning, similar to menopause, and discomfort, especially if breastfeeding, which keeps estrogen low. The vagina gradually recovers elasticity and lubrication as hormone levels normalize, although vaginal delivery itself can cause stretching, tears, scarring, or changes in sensation, which may or may not be permanent. Perimenopause.
Influence.
Ovarian function begins to decline, leading to fluctuating and eventually decreasing estrogen levels.
Characteristics.
Menstrual cycles become irregular. Early signs of vaginal atrophy may start, slight decrease in lubrication, potential for minor irritation or discomfort during intercourse. Changes are often subtle initially and gradually progress. Menopause and postmenopause.
Influence.
Very low and stable estrogen levels as ovarian function ceases.
Characteristics collectively known as genital urinary syndrome of menopause, GSM, or vaginal atrophy.
Thinning, the vaginal lining becomes significantly thinner, drier, and less elastic. The rugae folds flatten out. Dryness, reduced natural lubrication is common, leading to discomfort, itching, burning, and pain during sexual activity, dyspareunia. pH change, the pH becomes less acidic, more neutral or alkaline, similar to pre-puberty, reducing the protective effect of lactobacillus and increasing susceptibility to infections, vaginitis, and urinary tract infections, UTIs. Appearance, the vaginal canal may become shorter and narrower. The opening, introitus, may constrict. The tissue may appear pale due to reduced blood flow. Vulva changes, the labia may thin, and pubic hair may decrease. Other symptoms, increased urinary urgency, frequency, and incontinence can also occur due to related changes in the urinary tract. These changes are a natural part of life. If you experience discomfort, pain, unusual discharge, or other concerns at any stage, it's important to consult a healthcare provider, like a gynecologist, for evaluation and appropriate management.